Hello everyone, how are you all? This is the second video in the series and it's to do really with the lower limb. Now, first of all, I'm going to talk about lying on your tummy. Lying on your tummy is very, very important. Now, not all of us can lie on our tummy because with the contractions that are there, they can be quite severe, and to lie on your tummy is quite difficult. So for a good few people, unfortunately, lying on your tummy is very difficult to do, and it would be very painful, and it would do more harm than good. But for some people who have mild contractions in the hip and in the hamstrings, lying on the tummy is actually quite good, and we should be doing a lot of it more often. And there's a couple of things to consider when you want to lie on your tummy. Obviously, if you're dealing with an adult, it's quite a large person, and to physically turn them over onto their tummy, it takes a lot of thought. And you want to do it so that you don't hurt the person that you're working with. So, like I say, think about it, whether people can lie on their tummy or not. It might be a bit too much for some people, but for some, and you know who you are, because I get you lying on your tummy in the centre. I want you to lie on your tummy a bit more while you're off during this virus outbreak. So let's just recap on why lying on your tummy is important. Like I said, when you lie on your tummy, you get extended. So like standing, you get extension here at the hips, so your hips are nice and straight, your abdomens are straight, and your pecs get pushed back in this position. So when you lie on your tummy, you naturally get a lot of go into extension, and you get really good, your spine is lovely and straight. Because if you think about it, if you do have CP, you tend to be quite flexed. You tend to sit a lot more often than other people, and you tend to get very, very tight in that sitting position all day. And when you're sitting down, you're flexed here, the hips, and you're kind of leaning forwards, and your shoulders are kind of forwards like such, and your abdomen, your whole digestive system, your breathing, because when you straighten up, your lungs, they get a good stretch, and your pecs get a good stretch, and you use all those muscles like your pecs and your intercostals and your diaphragm for breathing. So in a nutshell, trying to get a bit of extension, trying to lie on your tummy is very, very important. And for those who do get to lie on your tummy in the centre, I want you to try and lie on your tummy at home. So what I'll do first of all is I'm just going to show you how to maybe transition from maybe sitting on the bed or sitting on the floor to lying on your tummy. So let's just say you're lying like such. So you want to get into side lying. So most people find getting into this side lying position quite good. If you stand over here as well in the corner. I think the hardest thing about getting somebody that's has severe enough cerebral palsy is the shoulder. Try and lift that shoulder up and get over onto the side. But what you can do is you can have your legs like such, go into the kind of recovery position as we call it, and what you can do then is maybe get the shoulder up here like such, and then just roll the person over onto their side. And when they're on their side, it might be quite difficult at the start. So there's little tricks that you can do. The first trick is to actually have a pillow. So have a pillow there, and they roll over onto their side, onto their tummy. And the pillow's there underneath the pelvis. So they're on their side, and as you roll the person onto their tummy, you try and make sure that pillow's sitting there underneath the pelvis. Because if you have contractures in your hips, your hips are like such, and you need to kind of, it's unfair to look for full extension. So you find a halfway house, and that would be in this position where you have a pillow underneath your hips. Now also, I have a pillow under the feet like such. So we have two pillows, one underneath the pelvis and one underneath the feet. And now we're lying on our tummies. And if we can, try and maybe bring the hands out like that. If we can. And that just gets a bit of retraction in the shoulder. Now this position is very, very effective. And you need to try and see, can you do that? Like I said earlier on in the video, a lot of the people that come to the centre, I try and get them lying on their tummy. You know who you are. Obviously, if there's a peg in situ, maybe give it a miss. Try lying on their side. That's something that you can do. Give them a different position, and you can lie somebody on their side like that. So where one leg is kind of, one hip is kind of straight and one is bent, and this is lying on your side, and that's a good position, because we want to vary the position throughout the day. We tend to sit a lot, and it's good. Like if you go to bed at night, you might lie on your back. So sometimes it might be a good idea just lie on your side, and that's good. So back to lying on your tummy. If you stay on your tummy for about 20 minutes, it's really worth it. And like I say, you're stretching the hips, you're stretching your hamstrings because your legs want to go straight. Gravity kind of pulls them down. Obviously, if the hamstrings are quite contracted, you might need 2 pillows to facilitate the tightness in the hamstrings. And obviously, there's a pillow underneath here as well. And if you can tolerate that position for 10-15 minutes, that's really, really good. Try and build up to 20 minutes. You could be listening to music in this position. You could be watching TV. So try and make it interesting. But it's really worth it if you can do it. It is really, really worth it if you can do it, because like I said, it helps with your breathing, because you're getting this extension in your trunk. It helps with your digestive system. It helps with your hip flexors here. Helps with your hamstrings. It helps with your lower back. So it really, really does kill a lot of birds with the one stone. So try and give it a go. Some people, like I say, they can't do that. So you have to be aware of if it's safe to do it or not. If you have a peg, probably give it a miss in situ. Some people get sick if they lie on their tummy, and that happens to some people. So it may not be a good idea. People who are non-verbal, you want to be careful doing it as well, because they might be able to express pain. So you need to look at the non-verbal cues, which I spoke about briefly in the previous video. So give it a go, see how you get on, and if you have any questions, please feel free to come back to me. Now the next video will be with the hip, the knee, and the calves, and hopefully we'll have that done in the next couple of days. So in the meantime, take care. Best of luck. If you can lie on your tummy, try it. And like I say, the people who are watching this video, if I get you lying on your tummy or not in the centre. So if I do, you try and do it yourself at home. It'll be definitely worth it. So take care of yourselves, and I'll talk to you in a couple of days. Thank you.